Support for Connecticut East this week comes from Newport Mansions, now offering a limited guide-led experience of the third floor of the Breakers Mansion. Never-before-seen private bedrooms, bathrooms and recreational spaces used by the Vanderbilt family and household staff for more than a century. Tickets and information at newportmansions.org. Alliance for Living, the only HIV/AIDS service organisation and resource centre in Southeastern Connecticut that also deals with homelessness and assists people dealing with substance use disorder. To learn more, including working with us, visit allianceforliving.org. And SCAD, the Southeastern Council on Alcoholism and Drug Dependence, is offering a $3,500 sign-on bonus for licensed clinicians. Go to licensedclinicians.org to learn more. That's licensedclinicians.org. Eastern Connecticut is facing a childcare and workforce crisis. So what can be done? We talked to the United Way of Southeastern Connecticut about their plans and how it will take the entire community to solve the problem. Plus, we take a look at other stories making the headlines from around the region. This is Connecticut East This Week. Hello, I'm Brian Scott Smith. Childcare in Connecticut and the nation is facing a crisis, not only in how much it costs, but a severe lack of spaces for young children and a lack of providers. And in Eastern Connecticut, the situation is so bad, it has created childcare deserts and employers who are unable to take on new staff because of the lack of services. So what can be done? I sat down with Dina Sears-Graves, President and CEO of United Way of Southeastern Connecticut, and Scott Umble, their Vice President of Community Impact, to find out what they and their partners are doing to begin to solve this major problem. To you both, thanks ever so much for joining us on the podcast. A crisis in child care here in Southeastern Connecticut. When we use that word here, it really does mean that. Dina, what is the problem here in Southeastern Connecticut that you and your partners have identified?
We definitely have a childcare crisis here in Eastern Connecticut. We, as many of you know, Electric Boat is having a massive hiring where they have to hire over 5,000 employees. A lot of them will require childcare. In addition to, we have two large casinos. We have the world's largest casinos in our area also that is in need for childcare services as well. But where the crisis comes in is there just isn't enough slots for people to actually put their children into affordable quality daycare. And so that's a huge problem because what happens is people are not then able to go to work because they don't have suitable childcare.
Scott, turning to you, March of this year, United Way of Southeastern Connecticut convened a meeting with various employers, partners, etc. It was very eye-opening. I came to it as well, and listening to those figures was staggering. We're not going to get too heavy into the figures because there is a lot of figures there, but just to give the listeners an idea, what's the percentage of unmet need here just in Southeastern Connecticut?
So just looking just in Southeastern Connecticut, New London County, there's a 56% gap between the demand for those that are needing services, needing their child to be somewhere, versus the actual capacity of our system right now. That 56% gap, that's 4,000 seats that are vacant right now. To Dina's point, that's the crisis part, that it's not a mild problem, but a significant challenge.
Let me put this question to both of you. Were you both surprised when you saw those figures? Because that sounds a startling figure, even though some people go, 4,000 doesn't sound much. But for an area of Connecticut, that is huge.
Yeah, it is alarming in a sense because we want to get our folks in our community working. And if that's a roadblock to people working, that's a huge problem. And then when you see 4,000 and you think about how many people actually live in our county, that's crisis to me. Absolutely. So it is shocking to see it actually in print.
Obviously, we're talking about Southeastern Connecticut. Now, just very briefly, we'll also mention, of course, Northeastern Connecticut still has that same situation. And if not, that's probably amplified a little bit more up there because, they've got other aspects that cause that to be an issue like lack of transportation, etc. So it's really an Eastern Connecticut problem that we're talking about, isn't it?
Yeah, and what we're seeing, when you look at the whole, Eastern Connecticut as a whole, what you're seeing is more childcare deserts. And so not only are there, is there a lack of slots, there's just a lack of childcare in general. So there's just not facilities. There's not large-scale childcare centers throughout Eastern Connecticut. And so, again, there's deserts. And so, again, there's just lack of it. So families are really struggling to find places to put their children while they're working.
Scott, United Way of Southeastern Connecticut and United Way are obviously a very well-known organisations, do a lot of great work, not just here in Connecticut, but obviously elsewhere as well. Why were you so interested? Why was United Way of Southeastern Connecticut determined to sort of like ultimately become the gatekeeper of this, which is what you have now become? Why was it important for you to do that? And what does it mean moving forward as well?
I think we can see the need from our community, from the providers, the employers, parents. From that first meeting you mentioned in March, we had nearly 70 people in that space. We didn't really know what to expect when we put out the call to get people in the room. So just that attendance there, and that was significant employers from our hospitals to the casinos to Electric Boat, all leaning in and saying, this is a problem for us. I think United Way has a particular skill in, we're not the experts in any particular space, but we're very good at convening those experts and the people that work in those spaces. So I think why United Way is leaning into this is because we have that ability to recognize a significant problem in the community, to raise that up, to rally folks around that problem. And now we have a framework that we've developed with other practices to guide those folks, those people in the room through a process to start identifying strategies and solutions and organizing community members to get that done. Because United Way is not going to be the one doing the work. We'll be organizing the work.
Yeah, I was going to say, you actually acted pretty quickly, because by April 30th, you had your very first childcare workforce shortage work group. Again, I attended that. It was very interesting to see the people that turned up, the energy in the room, and also obviously this information which is coming in. And that's the other important thing, isn't it, to both of you? Data is everything, because until people actually see it, either physically on a piece of paper in a presentation, I don't think people actually realise that there is a problem out there.
Yeah, no, absolutely. And I think we kind of glossed over the workforce shortage piece, and why the importance of that being our first work group is because, I think a lot of times when you see the number and people are like, well, just open more classrooms, right? It shouldn't be that hard. Let's just have more slots available. But the problem is we don't have the staffing in our area, or actually this is what's happening across the country. There is a workforce shortage with childcare providers. The pay is not great. And so, it's not really a profession that people are drawn to. So it's becoming a crisis because, again, there's ratios that are involved with childcare. And so if you don't have the workforce, you can't just have classrooms where kids can come.
And Eastern Connecticut does have a bit of a tendency to get ignored as well, doesn't it? I mean, I've spoken and I've interviewed plenty of legislators. Kathy Austin, I know, is vehement in making sure that, and other legislators, I don't want to sound like Kathy's the only one, they are all very hot on making sure that Eastern Connecticut doesn't get forgotten. Although we've got plenty of people here and industry, from a density of population, we have two of the smaller populations in the state. Interestingly, though, although the legislative session is now over, didn't quite get everything that, obviously everybody wanted. There was some positives that came out of that. Dina, talk to us a little bit about some of those. One of the things that was mentioned in both of your previous meetings was these childcare incubators, which weirdly had been restricted to a certain part of the state. That is not the case anymore. Talk to us about that.
Yeah, absolutely. So the incubator model is a support, and it's a program to get family home care providers set up, because obviously it's a business. And so making sure people have all the skills, and basically it's bringing them into locations and making sure they know how to do their bookkeeping and, all those things that go along with just opening up a childcare family home provider. Because of the way the program is set up, they only had it slotted for 7 cities throughout Connecticut. And unfortunately, there was none east of the Connecticut River. So we are very fortunate in this go around that they have opened that up to 20 locations now. And so we're really excited because here's an opportunity for us to, for incubators to actually get workforce involved. And again, this is about growing our workforce. And so home care is an alternative, especially if you don't, again, when you think about those childcare deserts in the middle of Eastern Connecticut, that's, those are actually prime for home daycare. So, because again, it might not be a place for a huge center, but it's an opportunity for people to actually set up daycare in their homes. And so these incubators will prepare people to be able to do that. And so we're really hopeful and we're really ecstatic that we're going to be able to have that opportunity to test this and see if we can get that going here in Eastern Connecticut.
Yeah, it's an interesting concept, because I know that the expert that was here at that very first meeting was was explaining how well it had done. I think it was within the New Britain area.
That's correct. Yep.
And I mean, it's entrepreneurial as well. I mean, it's creating business, but it's also creating a very needed service as well. And as you both already said, in an industry that sadly, doesn't pay the highest amount of money, but anything innovative like this certainly is getting that attention. Scott, what is your hope? I mean, Dean has just told us obviously a little bit about the incubators. There's still a lot to go, and as you've said, you're not the experts in it, but from your point of view, what would you like to see, maybe just from the incubators? We're going to see them get trialled here. Hopefully they're going to be a success. It's not the only solution though, is it?
No, it's not. That's what's so unique about this, of no one pathway is going to solve this problem. The gap is so enormous that we can't just build more childcare centers and hope that you can hire staff. So you're going to have to build staff pipelines. This incubator model is going to bring on other family-based, home-based programs. But that alone also, we would have to build and encourage new business owners in the thousands to close that gap. So it's going to have to be a lot of moving pieces and a lot of piloting multiple projects and approaches. I'm really excited about this incubator piece because there's a lot of different layers to it. It has this opportunity to also bring in new business owners, folks to have higher incomes and be a little more independent. And it doesn't have that enormous overhead of the hundreds, $1 million facilities that need to be built. So it's a unique opportunity that also aligns with United Way's strengths of really addressing that ALICE population, those that are living below their basic needs and affordability in our community. So I am amped by that amongst the many other components that are going to be a part of this project.
As we said, the legislative session came to an end on May 8th. There was actually a bill there which was originally tapped for $100 million from Connecticut as a seed fund. That was hopefully to be, for childcare trusts, and that money would be used for various things like this. It didn't come off, and the state basically said, no, we expect businesses and philanthropic organisations to basically deal with that instead. Just talk to us a little bit, Dina, if you would, without getting overly political, because that's not the purpose of this. But as much as it sounds like a negative, a lot of people said, no, actually that's a positive, because it means the money doesn't get, eaten up into a general fund, and actually we've got a little bit more control over this.
Yeah, I think it's a little tricky. Absolutely.
I'm oversimplifying it, obviously.
Yeah. But, when you think about all, Scott kind of, was talking about how there's so many different moving parts to this, we have to, as a community, address this. And this isn't a problem that just the state's going to be able to solve. We have to all solve this together. And so, yes, that does include business. It does include nonprofits. It does include philanthropy. It includes community at large. And so I think that is kind of, the lines that they were going. And, there's some truth to that. Would state funds help? Absolutely. But again, I don't think it's the only solution. And I think as a community, again, we have to rally and get together, all of us, to help solve this together.
Money was actually given out, even though obviously the budgets, they didn't want to break the fiscal guardrails. Again, it sounds big until you look at the figures and realise that, yeah, okay, millions of dollars sounds like a good way to be going, but, it is just a small amount that's needed. The Stabilisation Fund, which basically was another sort of like phrase for unspent ARPA money, which thankfully they're spending, because otherwise it would have gone back to the federal government, and nobody wants to see essential money like that go back. 18.8 million for Care for Kids program, which is obviously a very essential program. $8.2 million for other childcare and early childhood development programs. 26.2 million for behavioural health. So, there was a fair amount of money there, but it's really still a drop in the ocean, isn't it?
Yeah, because you have to think about that's not just for Eastern Connecticut, that's for the whole state of Connecticut. And again, when you look at how large this problem is, we're just talking about the numbers here in Eastern Connecticut or Southeastern Connecticut. But again, when you look at the state as a whole, it's huge, right? And so, yeah, that amount of money, although it is great and we're appreciative of that, I think that's part of the solution, but it is not the end of this. And so I think we have to be creative, we have to be innovative, and we have to all work together to figure out how we're going to close all the gaps in funding.
Yeah, because the ARPA money is great, but of course it's one and done. Once that money's spent, and of course, unless you can sort of like generate more revenue somewhere else or put it into businesses that start to generate that revenue, then that disappears. And obviously, we're back to looking at the state again to try and help out. Scott, talk to us a little bit, because you're the Vice President of Community Impact. When you talk to people in the community, not maybe just about this, but about other things as well. We'll just widen this out. What sort of reactions and and comments are you getting? I mean, are people understanding, and are they prepared to basically pony up and help out? out?
We're actually surprised on the number of even employers and businesses in our community that are so at a loss for how to solve this, because they're looking in their space, their silo with their 10, 12, 15 employees they're trying to onboard this quarter. So they're looking at it of, me as a business owner perhaps doesn't have a pathway to figure this out on their own, and they don't have a mechanism to bring that all together. And I think that's what's exciting about this project is we are actually bringing those employers together. And, these 3 banks that are struggling to hire 5 new tellers, now it's 3 or 4 or 5 banks, and we're combining that effort. And we've been surprised some of the initial conversations with some of those employers that they are interested in putting on real funds at the table as an investment, as an employee benefit, whatever that might look like, to help solve that problem, to either keep their employees that are having kids, their younger staff, or to onboard new employees. And that's been, I don't know if that's surprising, but a little bit of to hear that employers are interested in investing in their workforce. And that goes back to this crisis piece of this is not the usual same old of we have a minor problem, let's talk about it and sort of kumbaya come together. But instead, the employers cannot get to work. They have significant vacancies because people can't figure out a safe space with quality care for the child to be. And really just focusing on that part, it's been really interesting from just the employer perspective of their interest on leaning in and putting real money on the table.
That's the employer side, but I can't tell you how many people, and this goes across the board, about who will say, especially women, I've had trouble trying to find childcare for my child. And again, you hear these stories over and over, and that's from people that, are your Alice population, all the way up to, women that are, professional and making decent, really good money. And again, so this isn't a problem that's just, again, affecting one group of population. This is impacting our whole community.
And the other thing, of course, and you've just mentioned it, is women in the workplace. We are seeing women stepping out of the workplace and their careers because of this situation, which is just horrendous, because ultimately down the road, that's going to have such a huge knock-on effect for the economy, for obviously those individuals, as well as if they try to get back into the workforce. It's a dated view, really. Men are quite capable of looking after their children, yet still in the 21st century, we're seeing women being impacted the most on this.
Yeah. I mean, it's unfortunate. And I agree, yes, men are absolutely capable of that. But yes, the burden oftentimes does fall on the woman. So that is a crisis. Again, that's part of this crisis. And, we're taking steps back instead of moving forward. And it shouldn't be because of childcare.
Now, I know that you guys are also getting some support, a big support, I should say, from the Connecticut Project as well. They do a lot of good work around the state. Just talk to us about that partnership. And also, they funded something for you. Now, you're currently looking, I believe, for an individual, but just talk to us about it, because, that was a big step for you guys.
Yeah, we're really excited. We have a great partnership with the Connecticut Project. We are working with them, and they are funding us to be able to hire a person to help us coordinate all the childcare initiative here in Eastern Connecticut. So we're really thrilled about that, to actually have somebody that can manage. And there's a lot of, like Scott was saying, there's a lot of moving parts to this. And so, you need somebody that's actually, that's dedicated to that. And because of the Connecticut Project, we're able to do that. So we are currently in the process of hiring somebody. So we're really excited to see where this can go. We're just starting. We just dipped our toe. We just started this in March. So having somebody on board, we're thrilled. It's going to be awesome.
And the great thing is, as well, as that funding is for 3 years, which you hear about these things and you go, oh, that's great, they're going to fund something, and then you suddenly find out it's like, just for a year. This is 3 years worth of funding. So of course that gives you and the organizations time to possibly ramp up some more funding, etc., keep it all going. Because the point, of course, we need to make about this is there is no quick fix to this. We're looking at years down the road, which, people are going to be going, well, what's the point? But of course, you can't just fix everything with a click of a finger. We're talking a good, 5-10 years that, before we see this completely level out. So this needs a lot of commitment, doesn't it, Scott?
Yeah, it does. And, that 3 years, you say it sounds long, but it's a tiny little element of this very long pathway to solving this. Just even starting new businesses or the incubator model. The incubators for 2 years or more while they're developing their businesses before you churn out that group and bring in a new class. Some of these other models, and Dina shared, and we've said it many times, this project manager that's going to be supporting this project project, is going to be doing a lot of research on other successes in other communities. Because as you said, it's not just a Southeastern Connecticut problem. It's not even just a Connecticut problem. Nationally, this is an issue. There's a lot of other organizations that are experimenting with models around shared services, microsites, employer-based partnerships for childcare centers. So this person's going to be researching, visiting, learning more, and identifying opportunities to bring those models back here and like them pilot, test, see what fits, because we're going to have to layer a lot of different opportunities across to make any impact. Our goal for this project is closing that gap by at least 500 seats over the next 3 years. And that sounds daunting, but that's only 12, 13% of the actual problem. And so we have a long way to go to make big impact.
United Way's committed. And so we're really thankful that the Connecticut Project has stepped up and has committed 3 years of funding. But that's, I think, one of the strengths of United Way is, we're here for the community and for the long haul and trying to figure this out. And so we're in. We're very committed.
I mean, it's also about diversifying things. And I think the one thing, we hate to keep mentioning about COVID, but it was such a big thing. It showed the breaks in the system. And it also, I think, showed that there were too many single points of failure in so many different things. And that as population and as a community, we need to start looking at diversifying things out and having, these multiple touch points that can hopefully, be brought together to solve a problem.
And what's been interesting on the nonprofits community space response during COVID is it's required our partners or other organizations, the community, to lean in and partner and truly partner together to solve these really huge problems. And so we're tapping into that energy with this project, not for the first time, but for during the crisis, the pandemic of COVID, many organizations had to lean in, combine funding, bring in other funding from state and federal, and actually work together in different ways they haven't before, break down those silos, be more efficient on how they're approaching community. So we have that bedrock below us of we work together well. So we're going to be tapping into that a lot more and bringing our employers into that space with us now as well.
Well, it's been great talking to you. We've only just touched the surface of the iceberg, as it were, but this is, as we said, a big project. We're very grateful, of course, that the United Way of Southeastern Connecticut is spearheading it, and obviously with your partners, we'll continue to follow this story. But in the meantime, Dina Sears-Graves, President and CEO, and Scott Umble, Vice President of Community Impact of United Way of Southeastern Connecticut, thanks for being on the podcast.
Thank you.
Connecticut East This Week is made possible by Alliance for Living is the only HIV/AIDS service organisation and resource centre in southeastern Connecticut that also deals with homelessness and assists people dealing with substance use disorder. We provide a safe and confidential environment rooted in harm reduction. We offer a wide range of care to the community, including but not limited to case management, testing, syringe service program, and medical nutrition therapy. To view a full list of our services, please visit allianceforliving.org. Newport Mansions, as seen on HBO's The Gilded Age. Newport Mansions preserves and protects 11 historic properties and landscapes in Newport, Rhode Island, exemplifying 3 centuries of achievements in American architecture, decorative arts, and landscape design. Plan your visit this year and attend some of the mansion's signature events, including Newport Mansions Wine and Food Festival, September 20th to 22nd, and holidays at the Newport Mansions, November 23rd to January 1st. Tickets and info at newportmansions.org. And
SCAD, the Southeastern Council on Alcoholism and Drug Dependence, is looking for licensed clinicians and is offering the top benefits packages in the state. Go to licensedclinicians.org to learn more. That's licensedclinicians.org.
Time now for a look at other stories making the headlines this week. And this week we have just one story for you. Apart from this podcast, I also report for WSHU Public Radio in the state. And from January 2023 to early this year, I pursued a story about the Connecticut Port Authority and their State Pier project and the money it would take to complete it. It was a long process and involved the Freedom of Information Commission after the Port Authority denied a FOIA request I sent them. The information about State Pier was released by the Port Authority back in May of 2023, but we pursued the FOIA appeal because we wanted to see the documents around the project and why the Port Authority decided revealing them at the time wasn't in the public interest, a decision by them that was ultimately deemed wrong and a violation of the FOIA laws in the state. The cost to redevelop State Pier in New London into a hub for the offshore wind industry ballooned from around $93 million in 2019 to more than $250 million due to years of delays, overruns and redesigns. Fast forward to January 2023, with the project still unfinished, the Port Authority chairman David Kouros in an interview said they would be asking the state for a second round of money to finish State Pier. The year before, Kouros promised the State Bond Commission that taxpayers would not need to contribute additional funding for the project, but now he wouldn't reveal how much more was needed due to ongoing negotiations with contractors. WSHU submitted a Freedom of Information request to find out, which the Port Authority denied, saying the information was not in the public interest. WSHU appealed, and at a hearing, the Port Authority's lawyer had this to say.
So the CPA's position has been that those communications are premature, and to release those would impair the negotiation process. But they are in a position to produce those documents as soon as the contract is signed.
In January, a year later, the state's Freedom of Information Commission issued a finding against the Port Authority, saying their interpretation of state statute was wrong, and the commission instructed officials to hand over the relevant documents. In the document bundle WSHU received was an email dated January 2023 to Port Authority Interim Executive Director Ulysses Hammond, detailing two possible financial scenarios to meet the shortfall in funding to bring the State Pier project to a close. Those figures were between $25 and $40 million. So, over the past year, while the FOIA process was playing out, the Port Authority had a pretty good idea of how much money they would need from the state to finish State Pier, which is not what they told lawmakers, including Senator Heather Summers, a member of the Legislative Appropriations Committee.
It's deeply disappointing that a quasi-public agency would not be forthcoming with a legislature. They deliberately omitted the pertinent cost information when responding to my question regarding the State Pier project.
She inquired in April 2023 about the projected increased cost, but was also turned away due to ongoing negotiations. A spokesperson with the State Office of Policy and Management said the Port Authority contacted them earlier that month by phone, advising they would be seeking $30 million from the State Bond Commission for the project, as is required under state statute.
We just cannot tolerate the concealment of crucial information from the public domain, especially when the public is paying for it. It's not right.
The Port Authority released their request for additional state funding during its May board meeting, 1 month before they would go before the State Bond Commission in June for the sum of money, which the governor and the commission granted. Summers criticised the Port Authority that August after a state audit questioned how the Port Authority would use that money in its bidding process.
Unfortunately, it falls in line with the behavior that we have seen consistently from the Port Authority over the years.
State Pier today is all but finished. Crews have helped in the assembly of wind turbines for the South Fork and now Revolution wind farm projects, but it's come at a cost, $310 million to be precise, one of the state's most expensive maritime projects to date. State Pier is almost exclusively being used by the offshore wind industry, who are paying to use it under a 10-year agreement, which could be extended in the future. And at a recent business lunch in New London, State Pier was mentioned by Governor Ned Lamont, who has agreed the 2 rounds of bond funding for it.
State Pier, a little controversial, I remember that, but it's full, it's occupied, it's making money. Made $1 million last year. That means in 300 years we'll break even, but we're making a little bit of money on it.
This year, the Lamont administration had proposed merging the Port Authority into the Connecticut Airport Authority to form a new agency called the Connecticut Maritime Authority. Although the proposal failed to advance in the last legislative session, supporters sought to rein in the controversy at the Port Authority. Summers and other Republican senators opposed the measure. She is calling for more transparency and accountability from the Port Authority and its spending. That's all from us for this edition. Do send us your questions and story ideas to the show via our website at connecticut-east.com or Facebook or Twitter at Connecticut East and on Instagram at Connecticut East This Week. And you can listen to the show again on our social platforms, on demand, and by asking your smart speaker to play Connecticut East This Week podcast. And please like, follow, and share on your social media too. I'm Brian Scott Smith. Thank you for listening.